If you show up to an emergency room bleeding, in labor, or you can't breathe, they have to see you, even if you can't pay. That promise has a name, Emtala, or the Emergency Medical Treatment and Labor Act. There's a lot of noise about what it does and doesn't do out there right now, so let's clean it up. Emtala is a 1986 federal law that requires hospital ERs that take Medicare to screen you for an emergency condition and stabilize or safely transfer you somewhere else, regardless of insurance or immigration status. It's not a free care card. Hospitals can still bill you. Let's talk about some of the top myths going around about Emtala right now. Myth number 1, Emtala equals free health care for anyone. Nope. It guarantees an emergency screening and stabilizing care. It doesn't cover clinic costs. It doesn't cover clinic visits, elective care. Hospitals do bill patients afterwards. Myth number 2, that Emtala only helps citizens. Wrong. Emtala applies to anyone who comes to the ER. They don't check papers. Separate programs may limit insurance coverage for undocumented folks, but Emtala's emergency duty applies regardless of status. Myth number 3, Emtala forces elective abortions. This one's really wild. Emtala requires whatever stabilizes a true emergency. That can include pregnancy-related care when the patient's life or health is at serious risk. Courts have been wrestling with state bans that conflict with that duty, and as of mid-2024, the Supreme Court did not decide the merits and allowed emergency abortions to proceed for now while cases continue. So the federal government continues enforcing Emtala's emergency standard. What does all this mean for rural communities? Well, today's reality, Emtala keeps rural ER doors open. That's just a fact. To any emergency, really, which is crucial where there may be no other care for miles and miles. I might have to leave the county. But because stabilization must happen even when patients can't pay, rural hospitals carry more uncompensated care, and many of those are financially fragile. If Emtala were weakened or repealed, what would change? Hospitals could delay or even refuse emergency treatment based on your ability to pay or the paperwork you have with you. And that would almost certainly mean more patient dumping, longer delays, worse outcomes, especially where the next hospital is really far away. Any short-term savings to a hospital will be outweighed by higher mortality and downstream costs to families and the county governments themselves. That's the logic of why Congress passed Emtala in the first place. It really served 3 purposes. Prevent patient dumping, hospitals just leaving patients out in the road to bleed out and die, for lack of a better phrase there. It guarantees access to all, regardless of your immigration status or your ability to pay. But it also prevents hospitals from closing from these burdens of uncompensated emergency room care. We live in a society where we don't let people bleed out and die on the floor. And this bill ensures that the government will come in, step in, and pay some of those costs in those circumstances. So where's this fight right now? You'll keep hearing claims tying Emtala to free care, or you'll hear these partisan talking points, but the facts really are Emtala is emergency screening and stabilization, and you have bills still follow. Federal enforcement is ongoing while courts sort state law conflicts, but if someone says otherwise, ask them to cite the statute. Section 1867 of the Social Security Act is what makes this possible. In our next video, we'll talk a bit about how rural hospitals survive the treat first, bill later world and what the actual policy fixes are to keep doors open without breaking patients. Until then, this is Kellen from 3 Rural White Guys.